Hi friends, welcome to Physiodemic. Today I will tell you about the tennis elbow, which is a very common problem nowadays among the people. So many people suffer with elbow pains, and few of them diagnosed with lateral epicondylitis. So lateral epicondylitis is also known as the tennis elbow, and it is the most common overuse syndromes in the elbow, and it is a tendinopathy injury involving the extensor muscles of the forearm, which originates from the lateral epicondyle of the humerus. So now I'll tell you about the etiology. So the tennis elbow results in the hyaline degenerations of the origin of extensor tendon and overuse of the muscles and tendon of forearm with repetitive contractions causes maladaptations in the tendon structure that leads to the pain over the lateral epicondyle area. So this injury is often work related. Any activity involving wrist extensor, pronations and supinations are considered as important causal factors. So overuse repetitive movement also, and training error, misalignment, flexibilities problems, and muscles imbalance, agings. Now I'll tell you about the clinical features of the tennis elbow. So the pain on palpations over the lateral epicondyles area. Okay, and the flexibility and strength of the wrist extensors and posterior shoulder muscles reduced, weakness in the grips, and 99% of the patients recover within 1 year without any treatment. Now I will tell you about the differential diagnosis of the tennis elbow. So the first is the radial tunnel syndromes, then posterior interossseous syndromes, then the elbow osteoarthritis, radial head fracture, cervical radiculopathy, myofascial pain syndrome, and fibromyalgia. Now I'll tell you about the diagnosis procedure of the tennis elbow. So the diagnosis starts with the asking about the activity levels, occupational risk factors, sports participations, and other medical problems. So other methods of diagnosis are plain X-ray, ultrasounds, MRI, and EMG to rule out the nerve compressions. Now I'll tell you about the examination procedures and special tests. So all the special tests are Hojan test, chair test, mill test, and Morsley test. So in Hojan tests, patient's elbow is 90-degree reflex positions, and the position of patient's hand in radial deviation, and patient is asked to resist the wrist extension muscle extension. Pain over the lateral epicondyles is the positive test. In chair test, the patient is asked to lift the chair by using 3-finger pinch, and pain over the lateral epicondyle area is the positive test. In mill test, the therapist passively stretches the wrist in flexions and pronations, and pain over the lateral epicondyle area is the positive test. In Morsley test, therapist resists the extension of the third digit of the hand. Now I'll tell you about the treatment of the tennis elbow. So first I will tell you about the medical management of the tennis elbow. So in medical management, non-operative measures, the NSAIDs, icings, and elbow counterforce brace and steroid injection is used. So if then surgical approach is used if the conservative treatments fail for 6 months, and the surgical approaches are removing the diseased muscles and reattaching the healthy muscle to the bone. Now I will tell you about the physical therapy management of the tennis elbow. So the aim is to reduce the pain and improve the functions of the patient. The first technique is manual therapy technique, where the Mulligan therapy is very effective, and in second, the exercise therapy, where the strengthening and stretching techniques are used. So the other treatment methods are brace, splints, and the tapping techniques are used. And some study also shows that extracorporeal or shockwave therapy is also very effective. Now I'll tell you about the evidence-based practice of the tennis elbow. So one study shows that CDX is better the treatment as compared to the phonophoresis and exercises. And movement with mobilization techniques when combined with exercise has shown to have better results than corticosteroid injections. And one more study shows that Cervicothoracic mobilization technique combined with local treatments has better result than the local treatments alone. Ultrasound massage exercises has been shown to be no better than wait and see treatment. Then one more study shows that extracorporeal shockwave therapy, when it is given in moderate doses, is more effective. And one more technique is Mills manipulation, which is the most common methods of treatment, and where the patient is seated in arm in 90 degree of abduction and internal rotation. Therapist stand behind the patient, stabilize the wrist in full pronations and flexion, and the SBLA is given at the end range of elbow extensions. Okay, these are the techniques used for the treatments of the tennis elbow. So thanks for watching this video. Stay tuned to this Physiodemic channel for further updates video. Thank you.